Tammy Epperson's family is close, and today they are in a lot of pain. Epperson here survived COVID-19. Her mother, though, did not. She's planning her mom's funeral today. But local doctors say stories like theirs are becoming all too familiar. Households now, one of the places where they're seeing the most cases spread. So if that's the case, what are local doctors and our city leaders doing to protect our families from the virus? This will always be a bright moment for Tammy Epperson and her family. The last time they saw their mom, Erma Turner, smiling and celebrating another year of life. But this weekend, the family will gather for a funeral instead of a party.
She went in just feeling weak, and next thing we know, she was in the hospital. And she called and they said I had COVID.
Turner got sick, then her sister, and then her son, all living with her, all diagnosed with COVID-19. Within 3 weeks, they were all gone. Epperson says so too was her joy.
It wasn't time for my mom to go. It wasn't time. It wasn't time for my aunt to go. It wasn't time for my brother to go.
Epperson and her husband this summer also COVID-19 survivors. The one thing they all had in common, sharing a household. I asked Nashville doctors and Nashville Mayor John Cooper about the recent spike in cases in Nashville. They say unfortunately the Epperson situation is becoming more common.
We have seen some increase in people getting it in households, so it's percentage of cases, so getting it from first contacts and so forth.
In September and so far in October, Metro Health says households are where the virus is spreading the most over the workplace, social gatherings, and critical infrastructure like hospital and schools. And they're working on plans to better protect families. And when I asked the mayor about the case spike, he urged more people to do their part and follow the current guidelines.
We're going to wear a mask. We're going to socially distance. We're not going to go backwards.
But for families like the Eppersons, they're not sure if they can move forward.
We love our loved one, but when God get ready to come get them, there's nothing we could do.
And of course, for a long time now, doctors have really urged everyone to socially distance and, of course, quarantine if you've got the virus or came in contact with someone who does. Now, CDC taking it up a notch, saying if you or anyone else in your home has the virus, to now isolate. Stay in a room as much as you can stop the spread of the disease.
New tonight, for the past 3 years, Tennessee has led the country in our response to the human trafficking problem. But now, the nonprofit leading the charge, End Slavery Tennessee, is not getting any state funding due to the COVID-19 budget cuts. Right now, Fox 17 News' Kathleen Jacob is live downtown to explain how they're coping so they can still save lives. Kathleen.
Yeah, End Slavery Tennessee says that it's been tough, but they're adapting because they've had to. They say that they can't stop fighting this fight now that they hope that the public joins with them.
With cutbacks, closures, layoffs, and shutdowns, this year has forced everyone to adapt. And while so many industries have slowed, what hasn't is human trafficking.
We're just constantly trying to pivot on just to see how we can just make up the difference so that we can continue the important work that needs to be done to fight this fight.
Leah Moyer with End Slavery Tennessee says they've had to change their whole system.
We have seen a lot of our partner agencies just not at a place where they are referring at the same rate that they normally would be referring. Not because demand has gone away, but more so because they have also had to adjust their priorities, how they facilitate their services, and might not be in a place to see some of the signs and symptoms that they normally would be.
Take hotels, for example, limiting interaction with guests, or hospitals not being able to admit victim advocates, a total change in how they operate. On top of that, a giant slash in their budget. The state cut their funding to deal with the economic crisis.
I think with the challenges they've experienced as well, that lack of funding has definitely been one of the greatest hits in just our ability to respond appropriately as a state and union.
We reached out to the governor's office and asked, does he have a plan to help keep the momentum going in this fight? We have not received a response. For now, End Slavery Tennessee is calling on the public to be those extra eyes and ears, educating themselves on trafficking red flags and reporting when they think something's wrong.
If you'd like to help, we have a link on our website, fox17.com. We also have a section there where you are able to donate if you're able to.
Controversial new Metro law will let city workers in Nashville, besides just police and healthcare workers, issue tickets to people not wearing masks. New tonight, we're hearing from various departments about how they will implement this. Fox 17 News' Nikki Jenowitz finds out enforcement will look different than you may think.
In a city as large as Nashville, it is impossible to be everywhere at once. And that's what Metro leaders say they're finding while working to enforce emergency public health orders amid the coronavirus pandemic.
I think that it allows, again, more coverage in a way that encourages people to do the right thing.
To alleviate some of the pressure off of Metro Police and Metro Health, now multiple departments are going to be able to write citations. Brian Todd of Metro Health says it'll streamline the process for workers who already issue citations for other things.
One example is, if you have Metro codes or Metro water, you hear about issues with construction sites. So if they're already on the site and they see problems, it's really another tool in their toolbox to be able to build awareness.
Metro Health says 230 cases of coronavirus have been linked back to construction sites so far. But opponents argue it's not Metro Codes or Metro Water's job to change that, pointing to videos like these showing tense confrontations between citizens in violation with prevention guidelines and those enforcing them. From Metro Codes to Metro Water, from Public Works to the Beer Board, Fox 17 News reached out to every single department impacted and all stressed safety of their workers as their top priority.
And Fox 17 News reached out to the mayor's office to ask them what their plan is for avoiding this kind of conflict. And they responded with the following. Any Metro employee who is asked to enforce Metro's public health orders will receive proper training beforehand. All employees who are asked to participate will be enforcing our public health ordinances throughout the normal course of their everyday duties and responsibilities as Metro employees. As of now, no overtime is planned for employees.
And if they don't feel comfortable,
I don't think that there's anything that requires them to do that. It is, again, there's something that they could report to their supervisor and their supervisor could address. So it's not intent, the intent is not to put anybody in danger. The intent is to let people be aware.
Middle Tennessee hospitals preparing to boost their capacity, expecting more COVID and flu patients this fall and winter.
Now, this comes even as the state is lifting most restrictions on businesses and crowd sizes. Fox 17 News' Alex Zapple joining us live in Midtown with an explanation of how these two trends impact one another. Alex.
Well, Governor Bill Lee's lifting of restrictions on businesses and crowd sizes changes the responsibility to each of us individually to do the right thing, social distance, wear a mask. But does the medical community trust all of us to follow that? Well, that answer is more complicated.
At Maury Regional Hospitals, there's as many patients battling coronavirus right now as there has been at any point in the pandemic. Portions of Maury County glow red in the latest virus heat map.
We are looking to expand our capacity to make sure we not only take care of our COVID patients, but also to take care of all of the other diseases that we see.
Dr. Martin Cheney is the Chief Medical Officer at Maury Regional Hospitals, which has asked its community consistently to wear a mask from the outset, even as the county mayor avoided a mask mandate.
We are concerned that people are letting their guard down and masking is becoming more challenging, less accepted. And I think if we do that as a society, there will be a price to pay.
Governor Bill Lee has taken a hands-off approach to regulations in recent months. He watches data like hospital capacity and positive test rate, and Tuesday stood behind his decision to lift all business restrictions.
Our approach has been the same, regardless of where or when or how it rises. We need to do everything we can in those communities to mitigate the spread. And that's personal responsibility of Tennesseans.
Maury County Mayor Andy Ogles never issued a mask mandate, saying it infringed on personal liberty. When the county leaders won't, Cheney, though, has no problem reminding his community not to let its guard down.
I'm a big fan of masking. Our institution has, been encouraging our community from the beginning of this, that social responsibility and masking is a major key in preventing the spread of this disease.
The real challenge, really the biggest thing that could really throw all of the state's recovery out of whack is this. In communities even smaller than Maury County, more rural than that, when those patients get sick, there's less options for care. Sometimes they have to come here to Nashville, to St. Thomas, maybe Vanderbilt, down the street. That can overwhelm hospitals here, and from there, the state would have real trouble handling that capacity.